They are the vulnerable area, right? Because they're a congregation of the vulnerable population. We said no visitors, which is really dramatic and sad action, right? You're in a nursing home, you're alone, you look forward to family visiting, and then we say no family visitors. We're encouraging and working with the nursing homes for telecommunications and Skype and FaceTime and all that, but nothing new.
No plans to test all the workers there, the residents?
Yes, we have those regulations that before the staff comes in, they have to be tested.
Governor, I need to circle back on your comments regarding time matters, minutes count, this is a matter of life or death. How are you telling hospital staffers and hospitals in general to prepare while we wait to see whether the federal government hears your call to action? How are you telling people to prepare right now based on what you've described to us?
You got two separate tracks. It's a good question. Two separate tracks. One, state action. Assume no one else does anything but you, right? And I operate on that track. Assume the federal government doesn't do anything, and it's just New York State and New York State alone. And we're going down that track, and I'm doing everything possible on every level to do just that. And that's increasing the hospital capacity, minimum 50%, goal of 100%. They have to come up with a staffing plan to do that. That's finding the medical supplies for them. I'm not stopping on the medical supplies. We're manufacturing masks. I'm talking to uniform manufacturers to get them sewing machines to convert. I have apparel companies that manufacture in China to stop making dresses, to start making gowns. I mean, we're doing every kind of thing we can do. Child care facilities for healthcare workers, special protections for healthcare workers. Assume the federal government does nothing. And we have that plan in place. At the same time, I am saying to the federal government, you need to do what you need to do. There is a federal role here. And this emergency management protocol, well, we support the states. Yeah, you support the states if the states can do it. That's what the emergency management protocol is. I do this as a governor. There's a flood in Erie County. Okay, Erie County, you're in charge. Call me if you need something. Yeah, I get that. But if I know the flood can't be handled by Erie County, then I come in, and I'm the governor. And I come in and I say to the county executive, we're here, I'm the governor, I'm going to bring state resources. I'm saying to the federal government, and I'm saying to the president, you should take over the medical supply function. Invoke fully the Federal Defense Production Act, order manufacturing companies to manufacture it. Every state is saying, every city is saying they're running out of medical supplies. Do that. B, get FEMA, get the Army Corps of Engineers. You have the sites, tell them to come up here tomorrow and start building those emergency hospitals. C, pass the funding. Don't let the Congress make it pork barrel. Don't let them make it political patronage where everybody brings home 50 cents, but you actually don't fund the places that need it and the people that need it. Help the corporations, but don't help the corporations like we did in 2008, where the senior executives get tens of millions of dollars in bonuses, and now the taxpayers are supposed to fund that corporation to bail them out, and then the corporation 2 years from now is making record profits, and the normal economy hasn't rebounded, and the taxpayer who subsidized the corporation is still struggling to pay their mortgage. We did that in 2008. You want to give a corporation money? Say, okay, here are the rules. You can't buy back stock. I want the bonuses to CEOs back. I want an equity stake in the company. I want interest in the company, interest rate on the loan, but something that gets the profit back to the citizen. You know, we're tired of making these big corporations rich at taxpayers' expense. make sure the corporations live up to their civic responsibility, and you have total responsibility. If you're going to give them taxpayer money, then you get to write the rules. You know, from the president's point of view, this is back to his old job, right? Somebody walks in and says, I want an investment in my company. Okay, I'll give you an investment in your company, but here are the rules before I give you the investment in that company. I need the federal government to do that. The emergency supplies, the funding to the places that need it. I need my congressional delegation to actually represent the state of New York and deliver. We need FEMA here. We need Army Corps of Engineers here. We need those functions working as quickly as possible. And then we need federal assistance from the federal government. If none of that happens, then we're on our own. We're New Yorkers. We'll figure it out. Why don't you? I'm sorry?
Does the eviction waiver mean no need for rent freeze?
Does the eviction waiver mean no need? You cannot be evicted for non-payment of rent. One other piece of good news. You know, we talk about all these increasing cases, and you get the virus. Most people, the virus resolves. A good friend of mine, great public official, Rick Cotton, head of the Port Authority, he had the coronavirus, never hospitalized. He was home for 2 weeks. He is now tested negative for the coronavirus. So he self-resolved. It was about 2 weeks. I don't even know that he needed it all 2 weeks. I'm a little suspicious that maybe he resolved in 1 week and then he just took another week vacation, but I don't want to push the point. I'm going to go to work. Thank you guys very much. The state what? Oh, we are overwhelmed in the website. We have 700 people working on the website and telephones to handle the inflow of insurance claims.
The people out of jobs are telling us that the website is crashing. They don't know what to do.
It is crashing because we've never seen this volume. The IT consultants can't even figure out how to handle the volume. The volume is that high. But we have 700 people working on the website and phones, et cetera, to process those claims. I know people are frustrated. I get it. But we have never seen a volume like this in any state agency ever.
Room. Is that something that you would recommend at other hospitals?
That is not my area of expertise, so I'll leave it to them. Thank you.